Hello, this is Michelle DeFrancesco, and I will be presenting from the Arts Education Policy Review of 2017, an article entitled Intersections Between Music Education and Music Therapy: Education Reform, Arts Education, Exceptionality, and Policy at the Local Level by Karen Salvadora and Varvara Pasalib. The discussion focuses on provision of services and opportunity to learn and results in specific policy suggestions, including increasing administrators' understandings of music therapy, adaptive music education, and music education, so decisions regarding arts instruction can be better informed and more child-centered, and treating music therapists as allied health professionals who do not need to be certified teachers to practice in schools, and then improving initial music teacher preparation to improve music teaching and learning for students with special needs. When we compare music therapy to music education, the focus of an arts education is on artistic outcomes based on specific curriculums of skills that students must attain, whereas on the other hand, expressive arts therapists maintain a clear psychological intent and a therapeutic agenda, and that comes from Karku of 2009, page 11. Concerning the training and certification of therapists and educators, in the United States, music therapists must complete a bachelor's or a master's degree program approved by the American Music Therapy Association, AMTA, whereas music teachers earn a bachelor's degree in music education, which includes coursework in music content areas such as performance, history, theory, conducting, etc., by a university or college. Most states require also at least one teacher certification examination, such as Praxis, and at least one extended internship of 7 to 15 weeks teaching full-time in a school prior to certification. Both special education law and civil rights law dictate that schools cannot discriminate on the basis of disability. So if music education is provided, it needs to be available to all students in the school. The IDEA Act, the one that I talked about in my last presentation, the Individuals with Disabilities Education Act, mandates that students with exceptionalities be taught in the least restrictive environment. So students often attend music classes with their age peers when appropriate. And that's how they have it constructed now. However, the least restrictive environment for some students is a self-contained classroom. So many students attend music class as part of a self-contained classroom. And that's how I began teaching students with special needs, was in self-contained classrooms, because they had higher disability issues that needed them to be contained in one place. Some students attain music both with their age peers and with just their own peers in a self-contained class. Often, evaluation, diagnosis, and planning for provision of special education services takes place outside of the music setting and without participation of a music educator or a music therapist. If a music educator identifies a student who could benefit from extra special music services, they must fill out a non-discriminatory evaluation, otherwise known as an NDE. And it should explain that the need of the student in a regular classroom setting is that that student is seen to need music to help them. They're exceptionally good at music, or they have adapted to music and can learn from music. And if the music teacher identifies that, they must fill this NDE out, and then an IEP needs to be recorded as well, which I'll go into next. So following the completion of the NDE, the treatment team sets measurable educational goals, decides which services and supports will be provided, and writes this into an individual education plan. Which is an IEP. The IEP is a legal document that defines a school strategy for appropriate education of each exceptional child. That's by the U.S. Department of Education in 2011. However, many music teachers are not aware of the existence of IEPs, and they don't know how to access the documents. That lack of awareness or access is a problem, because all teachers are legally and ethically obligated not only to know what an IEP is, but also to carry out portions such as behavior plans for students. As recently as 2010, this may be, yes, 10, many music education degree programs did not offer or require a course that addressed exceptionality. That's by Salvador of 2010. And if a course was offered or required, it was usually through a college department of education or special education, not a music-specific course. This critical analysis, this report, revealed that all educators really need to develop skills in order to work in inclusive classrooms. In 2011, 8.4% of students in the United States received special education services under IDEA, and there are still more obtaining services through a 504 plan, which is called, that's from the Institute of Disability, 2013. So music teacher education programs really need to begin offering a music-specific course regarding inclusive instruction. And in closing, even with these additional pre-service education and professional development courses, many music teachers may not be best qualified to work with groups of students who have really severe and profound disabilities. Recently, Florida State University added a similar special music education concentration. Music teacher education programs, particularly those at institutions that house music therapy programs and have faculty with relevant expertise, might consider adding such programs that IDEA mandates so that all children can receive free and appropriate public education in the least restrictive environment. Thank you so much for listening, and I hope you have a good day, and I appreciate any questions or feedback. Peace.